Good morning or good afternoon. It's still morning here in England, but it's afternoon everywhere else, I guess. Okay, let's move on to the next slide then. I don't want to spend a lot of time on any of these individual slides. Obviously, that's the overall schematic of the way in which ERNICA is organised with its work streams and its work packages, with the coordination team there at the top, and with the ERNICA board. And I think the relevant detail around those are on the subsequent slides. So we move on to the next slide and just talk about the board and the way in which ePAGs are engaged with the board. So probably like most other ERNs, ERNICA's board has got one representative from each hospital. One thing that we have built into ERNICA's governance, I don't know whether any other ERNs have done, is to cap the number of votes which could be cast by hospitals from any one particular country. And the reason for that, of course, is that there's a big imbalance between the number of hospitals from some countries compared with others. For instance, in ERNICA, there's quite a few from France and Italy and Germany, and maybe only one from many others. So that's a kind of a safeguard, you know, from hospitals in countries kind of getting together to try and push ERNICA in one particular direction. Fortunately, I don't think we've ever had one proposal at a board meeting which has required a vote. I think they've always been unanimously agreed, so we've never needed to test this out. As far as the ePAGs are concerned, currently we have 3 ePAGs with a vote. That's the statutes states that each of the work groups, of which we have 6, can have one ePAG with a vote. At the moment, only 3 of those positions are actually taken up. We also have the situation where the lead ePAG and the deputy lead ePAG do attend the board meetings, but they don't have a vote. And there's a parallel for that with the coordinator. The coordinator does not have a vote, and the hospital that he is from, he ensures that somebody else from that hospital is there to represent the hospital. He takes an impartial, neutral position, which I think is good. The board meets, according to its statute, a minimum of once per year, but typically we meet twice, usually once face-to-face at the annual meeting, and then by video conference halfway through the year. Next slide, please. And again, it's probably similar to everybody else. The board responsibilities are stated in the statutes, and they do have these very specific responsibilities: disease coverage, network specific criteria, the membership, and any changes to the statute. And obviously work plans and progress reports are made at the board meetings. Next slide, please. Then we have the coordination team, or the executive management team, I think it was referred to maybe in the survey that we've just been listening the results to. So in ERNICA, the coordination team comprises the coordinator. There are two deputy coordinators. The project managers, currently we have 3, are involved with the coordination team, and I, as the lead ePAG, are a member of that team as well. And we meet typically once a quarter. Next slide, please. And the coordination team responsibilities, I won't go through them all, but these are taken directly from the statutes of ERNICA, okay? The sorts of things that you would expect to see are there. The next slide. And as far as ePAG engagement right the way through the network is concerned, well, each work stream, work group has an ePAG as a joint lead with 1 or 2 clinicians. And I say that there are some gaps at the moment, either because we have work groups that are not active, or we have a work group or some disease areas where we struggle to find patient representation. But that statement is true in terms of what the statutes of ERNICA say, in terms of the fact that each work group should be led by 1 or 2 clinicians with an ePAG as a joint lead. And of course, within the work packages and the work stream projects, there will be multiple ePAGs involved depending on the nature of the work. We've also had examples where ePAGs have actually led the projects with clinicians in supporting roles. And we do have at the moment 1 ePAG on the scientific committee, and dependent on decisions that are made about the priorities of the scientific committee for the coming year or years, we may get more ePAGs involved in the scientific committee. And I think the crucial point again is that the rights and the responsibilities of the ePAGs, including the specific role of the lead ePAG, is built into the ERNICA statutes. And that reflects the ePAG terms that we kind of all have agreed and were recommended by your audits. Next slide, please. So just some of you will have heard me talk about this before. I think what have been the factors contributing to success in ERNICA? Well, the coordinator has got a very strong view about the importance of patient engagement in the network. I think it's fair to say that our ePAGs, our patient representatives, are very professional in the way in which they engage with the clinicians. There's been a fair amount of prior experience of working on collaborative activities with many of the clinicians involved in ERNICA before ERNICA was actually formed. I think we've built a good level of mutual respect and trust. And I think also the fact that we have frequent communication with the project team. There's hardly a week goes by when I'm not in contact with the project team, 1 or more members of it in Rotterdam, and I have a good enough relationship with the coordinator to, be able to pick the phone up to him if I need to and communicate directly with him. And I think ERNICA generally recognises that the patients are a valuable resource and developing and actually crucially in implementing ERNICA's deliverables. Final slide, I think, is the last one. Yeah. So, I mean, look, I think the model works well generally, but I think my message is we can't be complacent, and we still see occasions that remind us that it's not instinctive for clinicians to remember to ensure patient representation. And occasionally ePAGs are missing from the meetings because, as I say, it's not instinctive, they forget, and we have to keep reminding them. It's probably true that ERNICA, particularly before the round of extensions that we had, enlargement that we had in 2021, I think ERNICA being a smaller network probably helped us. And the other thing that we have to continue to work at is plugging the gaps where we haven't yet found relevant patient organisations. But I'm pleased to say, actually, we've got about another 4 patient organisations that are engaging with ERNICA or have started to engage with ERNICA in the last 3, 4, 5 months.